I'd like to talk about this idea of the human exposome and how we pursue large-scale science. That's actually a picture of Chris Wilde there, was the person who coined the term in 2005 and who was a key supporter early on in the development. So I just want to kind of start with giving the framing of what is exposomics. And so this definition, which was developed over the course of a few days at Cold Spring Harbor Laboratory back over almost 2 years ago. The idea is it's the integrated compilation of all physical, chemical, biological, and psychosocial influences that affect biology and health. And by that, there's many different components to this. So we're talking about measuring chemicals, whether they be endogenous or exogenous chemicals in biological samples, blood, cerebrospinal fluid, bile, urine, whatever it would be. We can also measure pharmaceuticals, whether they be prescribed medications, over-the-counter, illicit drugs, whatever they are. We can measure thousands of these compounds in human samples now. We're also thinking about the personal monitoring, the devices that we wear that track where we are, that can track our sleep, that can track our movement, that can track even exposures to particulate matter. And then using geographical information systems to integrate all that information. So if you know where people are in space and time, you can actually figure out quite a bit about their exposures. And then trying to use advanced analytics to combine what we know at that individual level from biological samples to that geospatial side. And so there's a lot of very sophisticated data coming in. But one of the big goals here is to get to the point of doing an exposome-wide association study analogous to what genome-wide association studies did for genomics. The NEXUS grant, that we're of this NIH coordinating center that was funded just over a year ago, then the whole idea of this is to help facilitate investigators to incorporate exposomics into their research. So if they have a study on diabetes or lung cancer or heart disease, whatever it is helping them develop and adopt the tools that we've been working over time to integrate into their work. And why we need exposomics now. So if you go back shortly before the Human Genome Project was completed, and you look at a lot of what was being done in genetics, we had a lot of these candidate gene searches. People would suspect a gene or gene pathway was involved in a condition. They would check through all the variants for it, and if they found a positive response, they'd publish it. If it was negative, they wouldn't publish it. And so we had all these papers about these candidate genes that were linked to some condition, but when they could do genome-wide association studies, almost none of those were replicated. So the idea was that you were just, it's like kind of cherry picking these things. And environmental health has also been taking this sort of candidate-driven approach, is that you think, for example, microplastics or might be a heavy metal or something. If you're studying those individual compounds, we tend to bias the literature by publishing the positive aspects, but not do it in a systematic way. And so we think that we're at this point where we've seen some of this bias be introduced, and we need to have this exposome-wide framework so we can systematically study hundreds to thousands of exposures at a time. And I think this is something that we've wanted to get to, and I think we're very close now. So a paper came out last year in Nature Medicine that looked at the exposome in UK Biobank, comparing it to polygenic risk scores, and demonstrated that the majority of all-cause mortality was more due to the exposome than the genome. In that study, they used a lot of environmental epidemiological variables. They didn't actually use the biobanked samples that are available in UK Biobank because of the scale of that study. But more recently, Chirag Patel at Harvard University, he has a paper coming out in a couple weeks in Nature Medicine where he describes the platform for doing these exposome-wide association studies and using a study like kind of the NHANES model where you have all these different variables and able to lay these things out in a way that's very much analogous to what GWAS had done before. So I think we now have the tools and framework to do this. Clive mentioned this idea of linking it into genomics, and so this has been a very critical goal of ours, is how do we bring the genetics community and the exposome community together. So last October, Jana and I organized a conference at the Mendel Museum in Brno, Czech Republic. This is where Gregor Mendel did his pioneering experiments on peas, long ago. You see pea soup there up on the left. You can get that at any restaurant nearby. But it was really exciting because we had many top geneticists in the field. You and Bernie, Feminian BL was there. People are working on the Million Genome projects and thinking about how we can get these data sets together. Jana and I had the opportunity to interview Kari Stephenson, who was the founder of Decode Genetics. And he was quite skeptical when he came to the meeting, but at the end of it, he said genomics and exposomics cannot live without one another. Like, the idea is if you really want to study human disease, you need to do the G and the E at the same scale, and exposomics is the way to do that. I also just want to point out this kind of connection with AAAS, since we're at AAAS. We've had some very important papers published in Science, which is obviously AAAS's main journal. And we had a very good session last year in Boston, including R.A. Petrinos, who is the DOE lead on the Human Genome Project, kind of like what comes after the genome, and we were exploring the exposomics aspect. And in this paper on the right, just came out in Science in April, and that came out of that Cold Spring Harbor Banbury conference we had in identifying this sort of unified definition of the exposome. And obviously, Eureka Alert has also been great for promoting a lot of the work we do. So we feel a very strong connection to AAAS and the exposome. So exposomics has a relatively brief history compared to genetics. Really kind of slow the first 10 years, but in the last 5 to 10, it's really picked up a lot. But I think we have a very ambitious future, and I think there's going to be a lot of exciting work coming in this area in the next few years. So with that, I will just want to recognize the people that have helped support this work, and also point out some interesting coverage. Like, we've had articles in JAMA and PNAS kind of covering what's been happening in the field. Trog and I were interviewed on Mendel's Pod, which is a great name for a podcast, by Theryl Timpson, they've always done genetics, and they had this interview about exposomics. And I also really liked in Brno, the graffiti would quote Mendel. Like, that's the level of quoting of their graffiti in Brno, so it's really exciting. So with that, I will turn it over.